Hello, good evening. This is your mother witch, Nurse Jane. Here is the number 11 question. The nurse is measuring blood pressure as part of the home visit. Which blood pressure reading would cause the nurse refer the patient to for the normal blood pressure is on 130/90, in which having that higher than 140 could be on the level of stage 1 or in the yes classification of stage 1. But when you are going to ask what is the normal BP, don't you ever dare to tell me that's 120/80. Because you might put the patient into confusion that having, for example, at 110/8, 110/70 blood pressure, that's still normal. But telling the patient that's 120/80, that lead to a confusion. So the best way to answer that one is 90/60 to 130/90, so that the patient will have that a range rather. Now, a 120/80 is considered as the 120/80 is considered as pre-hypertension, right? So 120/80 is considered as pre-hypertension. Now, this 90/60 to 130, excuse me, 90/60 to 130/90 is considered as normal tension. Okay, normal tension. The term could be normal tension. Now, in the board examination, sometimes they will be asking about the Korotkoff sounds. Always remember the first sound will not be the systolic, but instead the third sound, the crisper sound, the loudest sound when you're going to take the BP, it is considered as the systolic. When I say systolic, that is on the contraction part, and while the diastolic is the relaxation. So commonly, there are topics about pulse pressure in the board exam. To get the pulse pressure, you have to deduct systolic minus diastolic. So for instance, you got a BP of 90/60, so 90 minus 60, and that is your pulse pressure. Alright? Alright, go back. Now, so when I say pulse pressure, what we're going to consider here is the result could be narrowed or, what do you call this one? Widened. Why is it very important, Nurse Jane? Because that is a complication. That is already a complication. And every complication, take note of that you need to refer to the physician. Okay? Notify the physician for every complication. In what situation wherein there is a widened pulse pressure? Usually, increased ICP after an injury to the head resulting to a widened pulse pressure. So for instance, the BP is 180/90. So let's have the normal first. 30 to 50 is a normal pulse pressure. So higher than that or lower than that, you need to refer it to the physician. Increased ICP for widened, while for narrowed, most of this patient experience shock. For narrowed, most of this patient experience shock. So again, still notify the physician. So what site would be the nurse most commonly used to assess the pulse of the infants and toddlers? So the correct answer is letter. Yes, very good. Brachial site. Alright, brachial site. Why not? Apical site is only related to newborn, but there's a toddler, you can use now the brachial site, especially when the patient is unconscious, an infant or a toddler, you need to perform your CPR, so you check the brachial site of the patient. Just to let you know, a newborn, newborn has no radial pulse. So once the newborn has a radial pulse, that is not normal to them. So there is what you call a problem, congenital heart defect. So you need to refer to the pediatrician. Let's go to number 13. The nurse placed one of the children with a high fever on a cooling blanket. How is heat loss achieved with this? Since we're talking about heat loss, and it is very important, especially to newborn, to prevent the heat loss due to the fact that they don't have enough subcutaneous fats. Only the vernix caseosa can protect them from any heat loss. So do not wipe the vernix caseosa when you are drying the patient. Thorough drying, but do not remove the vernix caseosa. Now, the question goes with heat loss in which cooling blanket is touching the patient with high fever. So once we touch, that means it's conduction. Once without touch, it means radiation. And once it's air current, for example, you cover the baby, you straddle the baby, and then you put a bonnet on the head, that is to prevent convection because malamig ang kwarto. Evaporation, especially when you have to bathe the baby after 24 hours of delivery, make sure that the baby must thoroughly dry for the fact that there's a water to the skin of the baby and the water will have to evaporate. That means lalamig ang pakiramdam ng baby, heat loss. 14. The nurse would understand which statement is correct. Okay. About RR, that RR is responsible for the part of the brain responsible for your respiration could be your medulla oblongata. Now, it's part of the brainstem, and the respiratory rate is very important because that would determine as well one of the essential function of our body. So, normal adult could have 12 to 20 cycles per minute, and that's letter B. The correct answer is letter B. 15. When the clinical patient scenario is associated with the most critical need for the nurse to obtain vital signs. So which clinical scenario? Alright, ambulating, no. Complaining of hunger, no. Ambulating of hunger, no. Complaining of pressure in the chest. Okay, that is chest pain. Then a chest pain, especially chest pain that is more being prioritized for the fact that it is more on oxygen concern. So angina pectoris, remember, this is a very situation in which it might lead to what you called myocardial infarction. So what we're going to do is to monitor, especially if their doctor ordered them a nitroglycerin pill that can be given sublingually. And how will you know that the nitroglycerin is effective? There is a burning sensation under the tongue. Okay? So that's number 15, letter B, boy. Let's go with number 16. When initiating a physical examination, which action should... Okay, physical examination is part of your assessment. Once it is a general assessment, always remember, as what I've said, general assessment goes with ipapera, while the abdominal assessment goes with, very good, iapurpa. So, the question goes with first. So, pag sinabing first, anong turo ni Nurse Jane basta first? Initial, anong unang gagawin? Assessment. And that makes it letter C. So, which identifies the order in which should complete the abdominal assessment? Iapurpa. So, inspection, auscultation, percussion, and shall we say, hold on. Inspection, auscultation. It's not per, it's perpa, percussion and palpation. Ipapera. Okay? It should be letter. There's a there is something to be exchanged here, the percussion and palpation. So why is it that auscultation must be first over palpation and percussion? We are trying to prevent that the abdominal peristalsis or bowel sounds will be disturbed. Now remember that in every quadrant of the abdomen must have what? Must have to assess every 5 minutes each quadrant. But take note, once the right lower quadrant is the first quadrant to be assessed. What if the right lower quadrant is having pain? So where are you going to start your auscultation? You start on the upper part or next to it. 18. If the nurse discovers that the patient's right elbow is swollen, painful during examination, which action should the nurse... Okay, again, the question is, which action should the nurse take next? So there is assessment already. Patient's right elbow is swollen. So you did your assessment. So hindi yan tinanong dito, okay, if the nurse discovers the patient's right elbow is swollen and painful during a physical examination, which action should the nurse take next? Okay. Now, yes, you did your assessment, right? On the other elbow, the right elbow. To make more definite assessment or more comprehensive assessment, especially its bilateral part of the body, you need to do your comparison. So still you do your assessment by inspecting the patient's left elbow to compare its appearance. Okay? Although it's not being said that it's first, because you did already your assessment. But then it's a continuation of assessment for comparison purposes. Letter D, dog. A nurse is preparing to auscultate a patient's chest. In which area should the nurse listen to evaluate the patient aortic? Okay, the question is aortic valve. An aortic valve is located mostly on the second right intercostal space. If you have answered the fifth left, along the mid-clavicular, that is your PMI, the point of maximum intensity, that is your mitral valve. Okay, that's a mitral valve. Fourth or fifth, yes, correct. So the correct answer here is letter A. To assess if a patient has a muscle hypertonicity, you will... Hypertonicity means that for you to understand the question, to assess if patient has a muscle hypertonicity, what does it mean? Is it hyper muscle movement or increased muscle movement? Now, hypertonicity is all about the stiffness of the muscle. So mostly this patient will experience this kind of manifestation. For instance, a patient with stroke. So in order for you to know that if there is hypertonicity of the muscle, you check if you perform a range of motion and there is a resistance on it, then that means there is hypertonicity. So which is the best answer? So letter C is the best answer for that. So that will be all for tonight. Good night, witches. Bye.